talented, qualified, engaged, and diverse workforce is at the heart of America's healthcare system. But hospitals and health systems face mounting and critical staffing shortages that could jeopardize access to care in the communities they serve. We've heard from our members that turnovers and vacancies are climbing, upwards of 30% for some positions, as they struggle to retain and support an exhausted workforce who have been on the front lines battling COVID-19 for nearly 2 years. And while some of these challenges do predate the pandemic, the toll it has taken means that the expected shortages by the end of the decade will top 3 million healthcare workers.
The last 20 months has really created the burning platform, right? We've seen the stress on our care teams. And for the first wave and even the second wave, right, our team members stepped up and they stretched and they extended themselves. Team-based delivery models, extending ratios, right? Things that our communities so desperately needed. But we've seen the toll. We've seen the fatigue. We've seen the challenges that it's taken at work and at home as COVID has impacted our communities.
You know, one thing in terms of Advocate Aurora Health was during much of the pandemic, the advantage of being a larger integrated health system came through. We had the ability to apply resources where needed. You know, if we had high-tech ECMO needs in one hospital, we could move people there. But now we're experiencing shortages throughout.
When I lost a nurse to an urban center, or I lost a professional to an urban center, there wasn't really a whole lot I could do. But now I'm losing them to hospitals all over. I'm losing them to critical access hospitals because they're able to pay more than we are, and obviously the urban hospitals. And then, of course, the contract labor, which I'm sure we're going to talk about in a little bit. But just to bring that point home, we have 265 FTEs, and as of this morning, we have 33 posted positions.
Increasingly, our healthcare workers are facing more challenging circumstances, both on and off the job. What are you hearing from your employees? And can you speak to how the challenges that they face today are perhaps different than they were at the beginning of the pandemic in early 2020?
The public support is not as visible, and our healthcare workers feel that. The increased divisiveness in society, we're also seeing in healthcare. Many times we'll have nurses and others who are caring for patients who have COVID, sometimes at the end of life, where the patient and the family don't believe that COVID is real, creating such a tension. Another area is that violence against healthcare workers, which has been a longstanding issue, has increased, I would say, recently. And in many cases, it's been in response to some of the interventions we use to decrease COVID transmission, such as masking, the visiting restrictions, and vaccine requirements. The other issue I'll just mention is just the length of time this has gone on.
Today, as I was walking around making my rounds, I ran into a housekeeper and I asked her how things were going. And she looked at me and, she almost started crying. And she said, Leonard, what happened? How come we went from being healthcare heroes to now to a point where nobody really cares anymore? They just want to know why we can't do our job better, why we can't hire more people, why we can't take care of the things that, that we used to do pre-COVID.
Hospitals have cared for over 3 million COVID patients since August of last year, and in many regions are still continuing to battle the Delta variant. What are the implications in terms of your hospital or health system's ability to care for patients? In the short and long term, will you have the capacity to meet new demands and maintain access to care in your communities?
You think of where we have nurses. I mean, for example, we have nurses in the hospital, in the home care, in the community. And if we don't have enough, it will impact services. In the beginning of the pandemic, we held on all elective cases. And we haven't needed to do that broadly yet, but we also don't see this crisis lifting. And I think we're just going to have to continue to pull every lever we can to meet the needs of our communities.
We don't want to deny services. There's very little that we do in hospitals that's elective care, right? What we did is we delayed a lot of medically necessary care, and we know it had a detrimental impact. And we know our job isn't just to provide great COVID care, but it's care for everyone that needs it. And so we've worked hard to restoring faith and trust in the community that we are here for you. restoring faith in our care team members that, right, we're going to support you and we're going to get the staff and the resources. But again, you could do certain things for a short period of time and stretch. But we know now 20 months in, and the likely, at least our predictions of another wave coming soon into the new year and others, that we need to build resiliency. We need to build teams, and we need to think around our healthcare delivery team is different. I think it really challenges us to think differently, and we need to, again, develop our pipelines of nursing students and physicians and things we'll talk about. But we also need to really foster innovation and team-based delivery models to recruit and retain talent.
We know hospitals and health systems across the country have faced challenges recruiting and retaining healthcare workers, particularly during the surges we've experienced. So could you talk a little bit more about how your individual hospitals or health systems are experiencing this, and maybe what you have, some strategies that you have employed?
A significant challenge that's been alluded to has been the loss of nurses to travel agencies. During the pandemic, the demand rose and rates increased. That's what often happens. And that has continued. But recently, it has just skyrocketed. Training was interrupted for many students, and we're seeing a higher number of nurses leave within their first year. And tens of thousands of qualified applicants are being turned away from nursing programs every year due to faculty shortages and lack of clinical sites. I think creating incentives to teach, grants for students, promoting SIM centers, these are some of the things where the federal and state governments can focus their efforts. And, we've done a lot of work in the health and well-being area, and that's an area that I think we've got to continue to focus on.
We've learned that to be competitive for talent, right, we need to develop more flexibility and align incentives, right? We need to develop flexible work schedules. We need to allow more people to work from home. So with their uncertainty, are my kids going to be in school this week, or are they going to have another surge? And so it affects their whole life. That I think as hospital leaders, we need to recognize our primary job is to recruit and retain talent.
Congress responded to the pandemic in part through the Provider Relief Fund, yet it still has undistributed funding, and no funding has gone to cover losses from the Delta variant. Can you talk about how your hospital or health system use PRF funding and how important it is for HHS to distribute all remaining funds as soon as possible?
The funding that was pushed out in 2020 to hospitals was the most amazing thing I ever saw in healthcare. They talked about it for a week, and 2 weeks later, the funds were in hospital accounts. That's amazing. That never happens. I've never seen anything like that happen before. And so, I think we have to give credit to the legislators who pushed that through and got with CMS and said, hey, and HHS, let's get this money out there. Nobody knows what this thing's really going to be over the next few months. We've asked them to shut down services. We've asked them to do all these kinds of things. We have to help them out. So to me, that was the most influential thing that Congress ever did, was push that money as quickly as it did. Now, what happened with that money is a completely different thing, because we were given options. Now, in our specific hospitals, we truly used that funding for what I feel like was to be able to cover lost revenues. And in fact, quite honestly, that money stretched out until this last August, and then it was gone. Then we were done. So when you talk about the $25 billion that's out there that's still available, I don't see any reason why that shouldn't be pushed out.
New pharmaceuticals, using PPE all the time, everyone, everywhere. Developing screening procedures and hiring staff or bringing staff in to do screening, testing, vaccination, paying for vaccines, but also getting vaccines out to the community as well as to our own employees. I mean, it's amazing the additional pieces that we've needed to add as a result of COVID-19. And I think, that speaks to the need for these funds.
This money was absolutely critical. I look as a state entity, what did we do with the money, right? We embraced the challenge of vaccinating more people in South Carolina than any other entity, not just at our hospitals, but in rural, underserved communities, at community health centers, at churches, and other areas. We embraced educating our community. We embraced distributing vaccines broadly, as well as ensuring that we had the right incentives for our teams to say, stay here in South Carolina, right? So you can care for your community.
What has your organization done to implement solutions to address the staffing shortage? And are there any new items that Congress could help us with?
We implemented a child care stipend, whether it was children not being able to go to school or being home for quarantine. This ended up being a very real issue for our workforce. Initially now we've had a multitude of compensation programs. And as I mentioned, that's a short-term approach. When I round and speak to nurses and other healthcare workers, and I ask them, what else could we be doing, or where do you get your biggest source of support? They say, it is from our team. It is from our team members. So really bringing that support down to the unit or departmental level. We've done that with a peer-to-peer support program where we have additional training for individuals so that they can recognize signs and symptoms of stress, depression, anxiety, even suicidal ideation. And we have a very strong program with our employee assistance and behavioral health. Longer term, we're partnering with schools, working with them to say, how do we keep that pipeline going? And how can we perhaps even fund individuals going through school with a commitment to work with us? And that we've done that in the past, and that has worked well. I also think we've got to focus on the narrative, again, about the value of healthcare careers, and in my case, specifically nursing.
The solution is really the foundation of, if we have the most engaged team that is truly recognizes their value, that they feel appreciated not only by their leaders, by their community, by each other, right? We will then deliver the safest care, the highest quality, the best experience, all those things that are in our statements. And while we talk about a lot of the things that we mentioned earlier in terms of the right incentives and developing it, the key is culture, right? And what are we doing as leaders to develop that culture of our workforce that they feel valued? We're not going to solve this just by training more nurses and physicians, and we need to do that too. But we really need to develop the pipeline, and starting at a young age of going to our schools and developing and sharing our passion, right? The passion we have with those students, and really working with our community colleges to align our goals to develop the broad workforce of the future.
Can you discuss, David, how these proposals can really help address the physician workforce shortage?
The shortage of physicians, the shortage of trainees, right, exacerbates our health disparities. It disproportionately impacts our rural and underserved areas where we struggle to recruit physicians in the setting of the shortage. So it goes back to our early conversation of matching supply and demand. And I think it's critical on the physician side that we match the supply and demand. And again, we strongly support the bill to expand 14,000 additional GME slots, right, to really ensure we have the physician workforce, not just in our urban areas and our large systems, right, but for what Leonard and our rural hospitals are trying to deal with. And that really gets into the pathway program and ways and means, and really understanding the importance of diversity in our workforce.
Supporting and strengthening the healthcare workforce is the #1 priority facing healthcare. Hospitals and health systems are working to address these staffing and workforce challenges immediately, but also developing long-term solutions. Congress can help in the short and long term by prioritizing funding that supports the healthcare workforce needs of our country.